Hi, I'm Dr. Paul Gardner, and today I'm going to talk about another topic related to blepharoplasty. Remember, blepharoplasty is surgery of the eyelids. And one of my favorite surgeries is a lower blepharoplasty because a lot of people will have puffiness of their lower lids and they'll have baggy skin, and it just makes them look tired. They may be the most alert people in the world, and it looks like they just never got a good night's rest. So lower lid blepharoplasty is one of my favorites because you get the best bang for your buck when you're doing plastic surgery with lower lids. You can really clean them up, make them look natural, and they look well rested. They don't look done, they just look well rested and refreshed. And it takes somebody who's very vigorous, who always looks sleepy because they have puffy eyes, and it makes them look much more refreshed. And one of the problems that can happen, particularly with the elderly, is the eyelid itself can pull away from the eyeball because it loses a lot of its tone as we age. So you'll actually see people whose eyelids kind of sag a little bit and it pulls away. And one of the risks with surgery when you do that is that as it heals, it can actually pull away from the eyeball and cause something called ectropion. So I actually do something in surgery to avoid that from happening. It's called a lateral canthopexy, and it's a temporary suture that I place at the time of the surgery to tighten the eyelid so that it can't pull away. So I'll demonstrate that with Brittany. As I mentioned, ectropion is when the eyelid can actually pull away from the eyeball as it's healing. What I do is I put this little suture, it's very tiny, can't see it, it's on the inside, and it tightens it so as the patient's healing, it can't pull away. And then it's a temporary suture, so in 2 weeks when it releases, the lid resumes its normal position, and it looks just like it did before surgery.